Welcome back to DesignCon Day 1. Officially, right off the keynote address is Mark Weed from Mayo Clinic. Thank you, Mark.
Well, thank you. I'm glad to be here today.
So your presentation, you talked about basically, essentially medicine of the future, which is really kind of going quickly. Can you talk about that? What does it look like? A Mayo Clinic's been around forever, and how does an organization like that step into the future?
So we're taking a clear look at where we see healthcare going and the move to remote care and home hospitals, home healthcare. We call it the Advanced Care at Home initiative is what we're working on. But there's also new tools and techniques coming in because of the power of artificial intelligence as well that all plays together to convince us that we have to fundamentally change the way that we approach healthcare.
So how long have you been at Mayo?
I've been at Mayo just over 37 years.
37 years. So did you ever see this coming?
We saw it coming. In fact, about 3 years ago, our new CEO, Gianrico Ferrugia, led us through the development of what we call our 2030 Bold Forward Plan. So that's our plan for where healthcare is going over the next decade. And what we anticipated then was this move to remote care and remote monitoring of patients, the fact that patients want to be seen at their community hospitals and at their homes. And so that's part of our strategic plan, and we were moving in that direction when the pandemic hit. And of course, what happened when the pandemic started is our remote visits went up by an order of about 20 times. And even now, a year and a half after the start of the pandemic, we're an order of magnitude more remote visits than we were prior to the pandemic. And that just reinforced the fact that we were making the right decision because we were able to establish that we can effectively care for many of our patients with remote visits.
So where do technologies like IoT and AI fit in all this?
Well, they're kind of fundamental to it because to be able to effectively monitor and treat patients in community hospitals and in particular in their home setting, we've got to have the ability to get data off them. And so that's where IoT comes in. We've all seen over the last decade just the huge inroad in consumer wearable devices, and that's really translating now into medical wearable devices, which are going to allow us to collect data from patients wherever they are.
So organizationally, how do you tie this together? Because you're not really in IT,
right?
But you're talking about some IT type things.
Well, sure. So Mayo has a group we stood up to directly address our digital platform future. So we brought in first a platform president, Dr. John Halamka came in about 2 years ago to help lead us through this effort. And then we created an internal group called our Connected Care Group. So it's a group that's leading us through this digital transformation. And so we are bringing in expertise from all over the country to come in and help Mayo develop the infrastructure we need to really support this transition that we're going through.
So do you still separate IT and engineering? And
there's so much overlap. There really is. But yes, there are some distinct differences as well. But for example, we've got our remote care at home group. They're working very closely with the IT folks because the IT folks have got to manage the large cloud data stores, and they've got to help get the new AI tools that we're using installed. We're partnering with Google to develop what's called an AI factory, for example, at Mayo, and our IT groups are heavily involved in doing that. And it's really kind of an interesting take on this because what we're finding is the innovation is coming out of our clinical specialties. So the cardiologists are looking at how they apply AI for cardiology, and the neurologists are looking at it for neurology. But what we know is we've got to be able to take these insights that we're coming up with and get them very quickly into the clinical workflow. So we're trying to develop standardized processes for doing that, to take these new learnings and get them into practice where we can treat the patients with them as soon as possible.
So you talked about healthcare at the edge. What did you mean by that?
Well, so the edge is really defined as the entry into a system. So for healthcare, that's getting the data off the patient. So to me, healthcare at the edge is this ability to do remote monitoring, remote therapy, remote diagnostics on patients. And this could be through wearable devices, or this could be simply devices that patients have in their home that are doing monitoring either continuously or on an intermittent basis, but having the mechanism for collecting that data, getting it up into the cloud, into the electronic medical record, where our physicians and care providers are able to make some decisions.
So it sounds like Mayo is heavily cloud invested.
Oh, absolutely, yeah. And I mean, I think it's sort of unavoidable at this point.
Isn't that tough with HIPAA and security and privacy and?
Well, sure, and so part of that is we're not using Microsoft OneDrive that you and I might be using for our personal stuff. Mayo is working very closely with the cloud providers to have a very secure, HIPAA compliant, cloud-based data store that we use to access our data. And businesses are doing this as well. This is a common thing. It has to be secure. It has to be encrypted. You have to be very careful with how you control access to it.
So with all this innovation, what keeps you awake at night, if anything?
Well, the main thing that keeps me awake at night is just kind of the excitement about where things are going. I'm so excited about the changes that we're going to be seeing in healthcare over the next 10 years. We've watched technology change. You and I have grown up with computers. You think about how the technology has changed since we were in high school to what we have available now. The next 10 years, I think, are going to have more innovation and more technology advancement than I've seen my entire career. So to me, this is just such an exciting time to be involved in
So just like
technology.
you talk about healthcare of the future, will there be the patient of the future as well? Will that be different?
Well, I think what's different is the access for patients to care, where they get it, when they get it. That is what's going to be changing. We're going to be able to provide care for people much more conveniently. And you think about it, the baby boomers, for example, we're getting older, but we're certainly healthier than previous generations were. We want to live in our homes and with our families and with our communities as long as possible. And the remote monitoring capabilities and this home care capabilities are going to give us the ability to do that, to keep us from having to move into an assisted living facility or a nursing home for much, much longer than was true for previous generations.
So Mayo is very leading edge, obviously, and it has been for a long time. When do you see these kinds of things trickling down to kind of the masses nationwide or worldwide?
Yeah, so one of the things that Mayo and probably the other large healthcare systems are doing are creating partnerships with community hospitals. We call it the Mayo Care Network. So we're developing partnerships really around the country and around the world. We're looking to have a global footprint, because once you start being able to provide healthcare remotely, you're no longer geographically limited. And I do expect that some of the major healthcare systems like Mayo, Cleveland Clinic, and others are going to be almost a central clearinghouse for this, and they're going to be partnering with rural hospitals, community hospitals to provide some of these services. And to me, that has huge advantages in terms of being able to provide care around the country and around the world, because we can now provide care in places where they may not have access to physicians. And think about the U.S. In our rural communities, there's this drain of physicians, because the physicians in these small communities where they grew up and have spent their whole careers are getting old, they're retiring, and the younger generation of physicians is not wanting to move into some of these small communities. Well, we're at a point where we can start providing some of those services remotely, so we can continue to provide care to remote communities in the United States. But now that's almost unlimited, because we can now start providing that kind of remote care to places around the world that don't have access to it.
So DesignCon is the first live conference in a long time. Is this your first live one in a while?
This is my first live conference since January 4 of 2020. I was at the IEEE Rising Stars Conference in Las Vegas, and that was my last
So what's it feel like to get back out in the real world?
Well, it's kind of interesting. The airport was a little crowded. I didn't like that very much. But it's nice actually getting to talk to people and interact with them. I really love the virtual world. We've been able to really effectively make use of Teams, Microsoft Teams and Zoom and the other tools for staying connected with people. But it's also nice to get back into an environment where there's a large number of people who have come together around this love of technology. There's an energy and an excitement here.
So is this the beginning of the back on the road for you?
Well, I don't think so, because we're heading the wrong direction right now with what's going on with the Delta variant. So I think things are going to slow down over the winter, and then I think we're going to hit a steady state.
Thank you so much.
Yeah,
really appreciate it.
Yep, thank you.